friends, welcome to my YouTube channel. Today we will study about abdominal aorta and its three main branches. The aorta, which is present at the level of thorax, continue in the abdominal region and it is known as abdominal aorta. It gives three main branches, that is celiac trunk, superior mesenteric artery and inferior mesenteric artery. The celiac trunk supplies the foregut derivatives, that is liver, stomach, spleen, pancreas, and a part of duodenum, whereas superior mesenteric artery supplies the part of small intestine and a part of large intestine, and inferior mesenteric artery supplies the remaining part of large intestine. Before going in detail about celiac trunk, we will first understand the diagram. This is the part of esophagus, stomach, which continues as duodenum. Behind the duodenum there lies pancreas, which is also behind the stomach, and behind the stomach there lies spleen. In order to understand all of the branches in a pictorial manner, I have combined all of them in one frame. Celiac trunk. Celiac trunk gives it left gastric branch, common hepatic and splenic branch. These are the three main branches of the celiac trunk. Left gastric artery gives it esophageal branches and gastric branches. Common hepatic artery continues as proper hepatic artery. Proper hepatic artery then divides into right hepatic artery and left hepatic artery. Right hepatic artery gives it cystic branch, that is cystic artery, which will go and supply the gallbladder and divides into superficial branch and deep branch. Let's have a view on it again. Common hepatic artery continues as proper hepatic artery, gives it right hepatic and left hepatic branch. Right hepatic branch continues as cystic artery. It gives cystic artery as a branch and divides into superficial and deep branch and supplies the gallbladder. Common hepatic artery also gives right gastric artery and gastroduodenal artery. Right gastric artery anastomose with left gastric artery at the lesser curvature of stomach. This is the lesser curvature and it is the greater curvature of the stomach. Gastroduodenal artery, which is a branch of common hepatic artery, continues as superior pancreaticoduodenal artery, which is related to the duodenum as well as the pancreas. The superior pancreaticoduodenal gives right gastric epiploic artery. Sometimes in some books it is also given as the gastroduodenal artery gives right gastric epiploic artery. The right gastric epiploic artery anastomose with the left gastric epiploic artery at the greater curvature of the stomach. Now we will go in detail about the splenic artery. The splenic artery arises from the celiac trunk, goes on the posterior surface of the stomach, hence it is shown in a dotted manner, which indicates that it is on the posterior surface of the stomach and give its branches to the pancreas, spleen as well as the stomach. The pancreatic branches also has arteria pancreatica magna as one of the branch, which is the largest branch among the pancreatic branches. The splenic artery supplies the spleen by giving splenic branches. The splenic artery also gives 5 to 7 gastric branches and left gastric epiploic artery. The left gastric epiploic artery anastomose with the right gastric epiploic artery, as we have seen earlier, on the greater curvature of stomach. In order to understand it in a simplified way, celiac trunk gives three main branches which are highlighted in green color. First one is left gastric artery, second common hepatic artery, and third splenic artery. The left gastric artery gives esophageal and gastric branches. Common hepatic artery gives three main branches: gastroduodenal, right gastric artery, and right hepatic artery. The right hepatic artery, which is written in RHA, gives cystic artery. The gastroduodenal artery also divides into two parts: superior pancreaticoduodenal artery and right gastroepiploic artery. The superior pancreaticoduodenal artery is sometimes considered as a continuation of gastroduodenal artery. Splenic artery. Splenic artery is one of the largest branch of the celiac trunk. The splenic artery gives three main branches: pancreatic branches, 5 to 7 gastric branches, and left gastroepiploic artery. The pancreatic branches gives two branches, which are the important one among the other branches, that is arteria chordae pancreas, which is present at the tail of the pancreas, and arteria pancreatica magna, which is one of the largest branch of the pancreatic branches. Thank you so much for watching this video. Please do like, share and subscribe.